Lady Gaga is an American singer, songwriter, actress, and record producer. She is known for her songs such as Just Dance, Poker Face, as well as Bad Romance, Telephone, and Alejandro. In September of 2017, Lady Gaga tweeted that she was suffering from a severe physical pain that has impacted her abilities to perform. Shortly afterwards, it was revealed that she had been suffering from fibromyalgia. Netflix has also released a documentary film called Gaga 5'2", which opens up with Lady Gaga talking about her overwhelming pain. So what is fibromyalgia? In this video, we are going to talk about the causes of fibromyalgia, how your doctor can diagnose you with it, as well as the treatment options, both medical and non-medical, for the disease. If this sounds like something you're interested in, stay tuned to find out more. Fibromyalgia is a group of chronic pain disorders that affects the connective tissues in your body, including the muscle, various ligaments, as well as joints and tendons. Patients with fibromyalgia, they often experience other symptoms such as depression, anxiety, fatigue, trouble sleeping, headaches, and mood disturbances. The exact cause and the optimal treatment for fibromyalgia is not really clear, but it is estimated that about 3 to 6% of the US population suffers from this disease, and it most commonly affects women between the age of 20 and 55. Although the cause of fibromyalgia is unknown, there are factors that are known to trigger symptoms in patients with the disease. Various factors such as emotional or physical stress from infection, injuries, or stress can trigger symptoms of fibromyalgia. Some doctors believe that fibromyalgia is caused by an increased sensitivity to pain in the nerves. There can also be a genetic component to this disease, which is why people who have parents or siblings with fibromyalgia are more likely to get this disease. The most common symptoms of fibromyalgia is widespread persistent pain. However, there is no visible abnormalities where the pain is felt. Patients often describe pain as a deep, muscular, aching pain, can feel sore, stiff, burning, or throbbing. Although there is always some kind of pain, it can change in intensity when you are stressed, anxious, cold, or tired. People more commonly feel pain in their necks, their shoulders, their backs, as well as their arms and legs. Other symptoms that accompany fibromyalgia includes recurrent headaches, migraine. Some patients get abdominal pain, they get constipation or diarrhea, and they'll have problems falling asleep and staying asleep. And sometimes when patients wake up even after a full night's sleep, they may still feel tired. Although patients with fibromyalgia often also have depression and anxiety, it is thought that fibromyalgia is not simply a manifestation of these psychological diseases. If you think that you have fibromyalgia, it is not a life-threatening disease, but you should still talk to your doctors to look for any available treatment and rule out other diseases. So how can a doctor tell if you have fibromyalgia? There's no specific imaging tests or any blood work that will diagnose the disease, but if you think you have fibromyalgia, doctors will take a complete history and physical exam to see if you have any of these symptoms that are suspicious for fibromyalgia. They may also want to do a limited amount of blood work, since fibromyalgia can mimic other diseases, and doctors will want to rule out these other serious diseases. And there are also other criteria that doctors can use, such as the ones from American College of Rheumatology, that will help the doctor evaluate your pain. When coming up with a treatment for fibromyalgia, it is important to set up the right expectations. Treatment for fibromyalgia can be challenging because there's no quick and easy cure. However, it is still possible to manage the symptoms of fibromyalgia, such as the muscle and joint pain, as well as the fatigue. Some doctors might prescribe medications such as an SSRI, SNRI, or tricyclic antidepressants, also known as TCAs, for fibromyalgia. And although these medications are most commonly used for psychiatric disorders, they have been shown to help with neuropathic pain as well. And other medications that doctors might prescribe are anti-seizure medications such as pregabalin or gabapentin, because they've also been shown to help with neuropathic pain. And lastly, I just want to mention that there is currently no evidence that long-term opioid use is effective in treating fibromyalgia, and it can actually lead to potentially long-term serious side effects such as addiction. If you're looking for a non-medical treatment for fibromyalgia, there are also other options. Regular exercise with a goal of at least 30 minutes 3 times a week have been shown to reduce pain. Some exercise you can try include walking, swimming, biking, which can also have a positive aspect on other parts of your health. You can ask your doctor to see if you can work with a physical therapist who can set up a exercise regimen that works best for you. Other relaxation techniques such as cognitive behavioral therapy, mind-body stress reduction, Tai Chi, yoga has been reported by patients to work as well. Fibromyalgia typically responds best to a combination of medications, exercise regimen, as well as a cognitive approach. So it might be helpful for you to have a team of healthcare professionals involved. If you enjoyed this video, remember to give me a thumbs up, and if you like these type of contents, remember to subscribe for more.